Today I'm here with Dr. David Ilceski. He's an OB/GYN here at UnityPoint Health Fort Dodge.
The biggest part is really just the variety that we get to experience, being able to have prenatal visits with patients and getting to see them kind of progress through pregnancy, annual visits where we get to see them on a yearly basis and see the kids that we kind of help deliver grow as they bring them in each year. I really like to kind of do things with my hands and being able to help solve patients' issues, that whether it's fibroids or endometriosis or things like that surgically. And then obviously helping bring life into this world is a great honor and a privilege to be able to be part of that.
And I hear there's like new lab work where you can find out the gender of the baby really early.
Really early,
We used to have to wait till 20 weeks when you had your ultrasound. So when is that visit?
So there's visits you can get done at your initial visit that you get with a nurse, or you can have a discussion with us or your provider in the office. And so that can be done as early as 9 weeks. There's blood tests that can check genetics and check gender. So it's really exciting, and a lot of people like to get that done.
Why should women have prenatal care before they're delivered?
Prenatal care is essentially where we get blood work and ultrasounds and visits kind of regularly throughout the pregnancy. And our ultimate goal is a healthy mom and a healthy baby. So there's a lot of changes that can happen to mom's body throughout pregnancy, and we want to kind of identify any risk factors or any red flags that we can pick up on things a little bit early. Same sort of thing for baby. As baby's kind of growing, we want to identify any problem issues and try to correct that as much as possible. So at the end, we can have a healthy baby and a healthy mom.
We have started the family planning clinic. Tell me a little bit about why that's important for Fort Dodge and how it benefits our community and our patients here.
It's an opportunity for us to be able to kind of provide care, whether it's preventative care, breast cancer screening, cervical cancer screening, or just as needed visits for birth control, STD testing, for patients who just don't have access to healthcare. Even though we're a smaller town, there's a large population of patients who don't have access to healthcare. And so I think that's a great thing that we're able to just start doing here.
We've become kind of the hub, if you will, serving the community, because there's up to maybe 40-mile radius of no other place to deliver. And so where are you going for outreaches, and how does that work? Yeah, so I mean, thankfully we have been growing and expanding. So we've been able to actually hire Lacey, one of our nurse practitioners who's new to us but not new to women's healthcare. She'll be doing well women visits, STD testing, birth control discussions, and she's going to be doing our outreach clinics. So we've got an outreach clinic in Humboldt, in Pocahontas, and in Eagle Grove. She'll be there on a weekly basis or a couple times a month depending on what her demand is. And then if she would find something, then she can refer in to the OB/GYN practice and get help and support should there be something that a woman needs further care for. Most people think about the robot being used for maybe general surgery, but tell us how OB/GYNs use the robotics. Really just GYN care, so we're able to do more complex surgeries and keep them here in Fort Dodge rather than sending them elsewhere and farther out. We're also able to do more complex surgeries, minimally invasive, which really helps the patients improve a lot faster. We have less blood loss, they have less pain, they stay in the hospital less. So cases that we would typically have to make a larger incision for, we're able to just do this robotically now. Yeah, we're very excited, and I think it's going to be a great benefit to the community. You have been a great blessing to this community, caring for lots of moms and babies coming into the world, as well as many surgeries under your belt here. And so we love having you and your family here, and so thank you for being part of our practice.